Welcome back to another episode of HealthCap Weekly Wrap.
Yeah, thanks for joining us. We've got a packed episode with the stories that really matter for senior living communities.
We're starting with the growing risk of measles and how provider groups, along with organizations like PALTmed, are stepping up the push for staff vaccinations to protect residents.
Right, and we'll follow that with new research from Stanford that warns measles could become endemic again in the U.S., along with some key takeaways from Medscape on what that means for long-term care.
Then we'll take a look at OSHA's latest data on work-related injuries and illnesses, giving us insight into trends that affect staff and resident well-being.
And finally, we'll cover CMS's latest moves to crack down on fraud, waste, and abuse, plus important FDA alerts about infusion pump issues that senior living providers need to have on their radar.
It's a lot to cover, so let's get started.
So let's kick things off with the measles story. It's really top of mind right now for senior living communities.
Yeah, cases are on the rise across the country. And what's concerning is that measles is incredibly contagious. Once it gets into a senior living community, it could spread before you even realize it.
Exactly. That's why groups like ACA, NCAL, and other provider organizations are pushing hard for staff vaccinations right now. McKnight's Long-Term Care News covered this, and they highlighted how important it is for staff to be up to date on their measles shots, especially since many of our residents have weakened immune systems and are at higher risk.
Right, and it's not just about protecting yourself. It's about protecting the residents we care for every day, those who can't fight off infections the way younger or healthier people can.
And PALTmed released a statement that really reinforces that message. They're urging healthcare workers to check their vaccination status and get immunized if needed. It's part of a broader effort to prevent outbreaks before they even start.
What I appreciated in both of those sources, McKnight's and PALTmed, is that they're not just sounding the alarm. They're offering practical guidance too. It's a call for senior living leaders to educate their teams, look at their policies, and make vaccination accessible.
Absolutely. This is a proactive step communities can take to protect residents and staff. And with cases popping up in different parts of the U.S., now's the time to act.
Yeah, it's really about being prepared, not waiting until there's a problem inside your walls.
So while providers are focusing on immediate action, there's also some new research that's giving us a glimpse of the bigger picture with measles.
Yeah, Stanford Medicine led a study that was published in JAMA, and it's kind of a wake-up call. They used large-scale modeling to look at how measles could spread in the U.S. at different vaccination rates.
And even at our current levels, which honestly aren't where they should be, the researchers are predicting that measles could become endemic again within the next 20 years.
Right, and when we say endemic, we're talking about measles circulating regularly in the U.S., not just popping up in isolated outbreaks.
Medscape did a nice job breaking down that study into key takeaways. They pointed out that small decreases in vaccination coverage could have a big impact on how measles spreads, especially in places like senior living communities where residents are more vulnerable.
Yeah, I think that's what really stood out. How fragile our current protection is. It doesn't take much of a drop in immunization rates to see real problems.
And that's why this research matters for our listeners. It's not just about what's happening today. It's about what could happen down the line if we don't stay focused on prevention.
Exactly. So between the calls for action from provider groups and this kind of long-term data, it really reinforces the need for strong vaccination programs in senior living communities.
All right, shifting gears now, let's talk about workplace safety.
Yeah, OSHA recently released its latest injury and illness data through the injury tracking application. And there's a lot that senior living leaders can take away from it.
Right. This data gives us establishment-specific details on work-related injuries and illnesses, so we can really see where risks are showing up in our communities.
And what's valuable is that it's not just numbers. It helps us identify trends, like where certain types of injuries are happening more often, or what kinds of incidents are being reported across the sector.
Exactly, and for senior living, that's a chance to look at your own safety practices. Are there areas where slips and falls among staff are higher? Are we seeing patterns in lifting injuries or exposure to illnesses?
OSHA's goal with this data is really to help employers, like senior living communities, take a closer look at their environments and find ways to reduce injuries before they happen.
And it's not just about compliance, right? It's about creating a better, healthier place to work, which ultimately helps us provide better care for our residents too.
Yeah, when staff feel supported and protected, it shows up in the way they care for residents.
All right. Next up, we've got an update from CMS that really highlights the importance of integrity in our field.
Yeah, CMS is stepping up its efforts to crack down on fraud, waste, and abuse in healthcare programs, and that absolutely includes senior living communities that participate in Medicare or Medicaid.
They've been really clear about this on their site. They're taking swift action to stop bad actors, prevent improper payments, and make sure resources are going where they're supposed to.
And I think what's important for our listeners is that this isn't just about going after criminals. It's about making sure policies and practices in our communities are tight, so we're not unintentionally falling into wasteful or non-compliant patterns.
Right, CMS is also looking at policy changes to reduce waste and abuse at the system level. So this is a good reminder for senior living leaders to review their internal processes.
Exactly. It's a chance to strengthen compliance programs, train staff on documentation, and really build a culture of accountability.
And of course, that helps protect the residents too. When resources aren't being wasted or misused, there's more focus on providing quality care.
All right, let's wrap up today's episode with some important equipment safety updates from the FDA.
Yeah, the FDA has issued several alerts about Smith's medical infusion pumps, and these are devices that a lot of senior living communities use, especially in higher acuity settings.
Right? One of the issues they flagged is thermal damage. There's a risk that these pumps could overheat during use, which could potentially cause harm.
And on top of that, there's an intermittent connection issue. Basically, the pump might stop working properly without warning, which could interrupt therapy.
And then there's also a false alarm problem. That could lead to unnecessary interruptions in care because staff might respond to an alert when nothing's actually wrong.
Exactly, and all of these issues could really impact resident care, whether it's delays in treatment or risks from equipment malfunction.
So for senior living leaders and clinical teams, it's important to review the FDA guidance, check your equipment, and work with suppliers to address these concerns.
Yeah, staying proactive on things like this helps ensure residents are getting the right care without unexpected interruptions.
And that's going to do it for this week's HealthCap Weekly Wrap.
Thanks so much for tuning in. We hope these updates help you stay informed and ready to support your teams and residents.
And don't forget, you can get more details on all of these stories in the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog.